When you think about a stroke, you probably associate it with someone older, maybe a grandparent in your life. But local doctors say they're seeing a rise in young patients with strokes. Last weekend, Justin Bieber's wife, Hailey Bieber, went to the hospital for stroke-like symptoms. According to CBS News, test results showed she suffered a very small blood clot in her brain. Her story grabbing a lot of attention because she's only 25 years old. Doctors I spoke with hope her story brings awareness to stroke symptoms and preventative measures, especially because they say someone in North Carolina is hospitalized with a stroke every 20 minutes. Doctors with Cone Health and Avant Health agree there could be multiple reasons younger people are experiencing strokes or stroke-like symptoms. Those include smoking, high blood pressure, high cholesterol, poor diet, and exercise. Genetics can also play a role, but Dr. Srishti Baggett says young women are especially at risk when pregnant or on birth control.
That high estrogen state is associated with an increased risk of stroke as well. Is the estrogen from being naturally pregnant or from the oral contraceptive hormones that kind of makes the blood a little thicker and more likely to form those blood clots that can go to the brain.
Dr. Lauren Peruski agrees and says COVID-19 also increased the risk of strokes.
The last couple of years, a lot of people have been trapped inside. The gyms have been closed, ordering in food. So that's kind of contributing, I think, to that trend in the younger population.
Both doctors say it's so vital to know the symptoms of a stroke. So remember this. B FAST. It's an acronym for those symptoms. B is for balance issues. E for eyes, if you can't see well or maybe have loss of vision. F is for maybe your face drooping, specifically on one side. A is for arm or leg, where you maybe can't feel your arm or leg, like having numbness. S is for speech difficulty, maybe you're slurring your words, you can't understand what people are saying. And T is for terrible headache, which is usually a sudden onset of a terrible headache, and it's usually worse than your typical headache. It can also mean time. It means time to get to the ER. So if you know anyone that's experiencing any of these symptoms, or maybe you yourself, call 911 or go immediately to the ER. There are treatments doctors can provide within the first few hours of symptoms when they begin, but after about 3 to 4 hours, there's not much they can do.